Welcome to the Neurokrish immersion. In this episode, we're talking about the brain's tug-of-war of Alexander Luria, the famous Russian neuropsychologist, limbic urges, and frontal restraint. Ask yourself, what makes you, you? The answer lies in ancient brain structures that evolved long before humans could ask the question. These primitive yet powerful systems govern our deepest emotions, memories, and the very essence of our personality, often operating beneath the threshold of conscious awareness. In today's journey through the neuropsychiatric landscape, we will talk a little bit about the prefrontal cortex and its neuropsychiatry of executive function and behavioral control. We'll talk about behavior and the role of the frontal lobe in personality and social cognition. We'll talk a bit about the limbic brain and how it governs emotion, memory, and motivation. And we'll derive insights about Luria and his proposition of dynamic equilibrium. This presentation explores the critical intersection between brain structure and behavioral manifestation, examining how damage to specific regions fundamentally alters human personality and function. One of the most famous stories in neuropsychiatry is of Phineas Gage. Well described by Dr. John Harlow, Phineas Gage, who was a responsible and socially well-adjusted person before his accident, became capricious, vacillating, and impatient of restraint. This was a railroad construction accident that took place on September 13, 1848 in Cavendish, Vermont, and it would become one of the most famous case studies in neuroscience, fundamentally changing our understanding of the relationship between brain structure and personality. What happened on that September day would echo through medical literature over 170 years. What happened was a catastrophic injury. A tamping iron measuring 3 feet and 7 inches in length and weighing 13 pounds was propelled through Gage's skull during a blasting accident. The trajectory was devastating, yet remarkably precise in its neurological consequences. The entry point for the tamping rod was the left cheek below the zygomatic arch. The exit point was the superior aspect of the cranium near the midline, the top of the skull. The result was a massive destruction of the left frontal lobe tissue, particularly what we know is now called the orbitofrontal cortex. What resulted was a profound personality transformation. Before the accident, Gage was known as a responsible, socially well-adjusted person, and his employers at Rutland and Burlington Railroad considered him one of their most efficient and capable foremen. Contemporary accounts describe him as shrewd in business matters, displaying excellent judgment and meticulous attention to detail. After the accident, Dr. John Harlow's longitudinal observations revealed a man fundamentally altered. Gage became capricious, vacillating between different plans of action. He demonstrated profound impatience and displayed socially inappropriate behavior. His physician famously wrote, "Gage was no longer Gage." The equilibrium between his intellectual faculties and his animal propensities had been destroyed. Modern computational neuroimaging techniques applied to Gage's preserved skull have revealed the precise extent of his injury. The damage was predominantly left-sided with significant orbitofrontal involvement bilaterally. This region is now understood to be critical for social cognition, emotional regulation, and decision-making processes that integrate emotional information with rational thought. The orbitofrontal cortex serves as a key node in the ventromedial prefrontal cortex, connecting the limbic system with higher cortical regions. The best way I can explain this to you is the orbitofrontal cortex is, think of the space in the skull where your eye is located. That's your orbit. And the frontal cortex, just there, is the orbitofrontal cortex. and the space between your ears is where your limbic system is located. Its destruction explains Gage's specific behavioral syndrome, intact basic cognition and memory, but profoundly disrupted social and emotional functioning. Gage's case demonstrated that you can lose yourself, your personality, your social cognition, your ability to navigate the human world without losing consciousness, memory, or basic intellectual function. This revolutionary observation established that personality and social behavior are localized to specific brain regions, challenging 19th century beliefs about the unitary nature of the mind and soul. The frontal lobes, particularly the ventromedial and orbitofrontal regions, emerged as the neuroanatomical substrate of human personality. From a neuropsychiatric perspective, it's important to understand that the limbic brain and its connections to the frontal cortex form the neuroanatomical basis of human personality, emotion, and social behavior. Phineas Gage's case established that personality and behavior are localized to these specific brain regions, and this foundational insight continues to guide modern neuropsychiatric practice. And of course, today we understand the whole concept of minimal or mild brain injury, and which recognizes that behavioral and personality changes often precede cognitive symptoms in neurodegenerative disease, creating opportunities for early intervention and prognostication. And indeed, it's therefore important to think about neurodegeneration and to do early assessments for people who are presenting with personality changes in midlife. For decades, the frontal cortex, the prefrontal cortex, was called the silent lobe because damage to this region didn't produce obvious motor or sensory deficits. This fundamental misunderstanding had devastating consequences. One of these was the whole concept of doing lobotomies. Between 1936 and 1967, over 40,000 prefrontal lobotomies were performed in the United States alone, based on the false assumption that this brain region served little critical function. The lesson we learned was the absence of motor deficit does not equal absence of function. Today, we understand that the prefrontal cortex is important for planning and memory, essential for complex cognitive tasks, working memory, and future-oriented thinking. It's important for what we call cognitive flexibility, which enables adaptation to changing circumstances and the mental shifting between concepts that are so much a part of everyday life. It's important for impulse control. It regulates our behavior, inhibits inappropriate responses, and guides social conduct. It's important for personality and identity, the core of who we are, our personality traits, our emotional regulation, and our sense of self. And indeed, today we know that depression is not a chemical imbalance. It's circuit dysfunction in which the prefrontal cortex has got a very important role to play. It's not just neurochemical in our understanding. The prefrontal cortex has got three critical regions. There is what we call the dorsolateral prefrontal cortex. And if you put your hands on either side of the front of your skull, that's where that is. Then we have the orbitofrontal cortex, which is, as I said, close to where your orbit or eyes are and the base of the brain. And then we have the medial prefrontal cortex, which is right in the middle between the two lobes of the brain. The dorsolateral prefrontal cortex is your executive office. It helps in planning, organizing, working memory, and cognitive control. The orbitofrontal cortex is your social regulator. It's important for impulse control, reward processing, and social decision making. And taking you back to Phineas Gage, this was where the problem was. The medial prefrontal cortex is your motivation engine. It's important for motivation, emotional processing, and behavioral initiation. Problems in the dorsolateral prefrontal cortex result in a syndrome, which includes loss of initiative, difficulty in starting tasks or activities without external prompting, a flattened affect, reduced emotional expression and engagement, apathy, a profound lack of interest or concern about activities and outcomes, and executive dysfunction, impaired planning, organizing, and problem-solving abilities. Perseveration, the inappropriate repetition of behaviors or responses, even when they are no longer appropriate, is something that happens as a part of this syndrome. Stimulus-bound behavior, actions being controlled by immediate environmental cues rather than internal goals. For example, if the examiner has left his spectacles on the table while talking to the client with a dorsolateral prefrontal cortex syndrome, the client will take the examiner's spectacles and put them on. This is a form of utilization without meaning. And diminished verbal fluency, an impairment in strategic word search and generation of appropriate responses. When the orbitofrontal cortex is affected, social cognition gets affected. So the person is not able to understand social cues or interpret others' emotions and intentions. There is problem with emotional regulation and modulating emotional responses appropriate to context. There is a problem with reward processing, evaluating outcomes and adapting behavior based on consequences. And there is a problem with impulse inhibition, suppressing inappropriate behavioral responses. And when the social regulator fails, there is disinhibition, a loss of behavioral restraint, acting without consideration of consequences, inappropriate affect or emotion, emotional expressions that don't match the social context. For example, laughing at funerals or being angry during celebrations. There is impaired judgment, repeatedly making poor decisions despite negative outcomes. And there is distractibility, the attention constantly being captured by irrelevant environmental stimuli. And this profound loss of inhibitory control also leads to impulsive risk-taking and socially inappropriate behavior that can devastate personal and professional relationships. This goes back exactly to how we started what we said about Phineas Gage. The medial frontal cortex, our motivation engine, has many regions. The dorsomedial region, which is responsible for emotional instability, inattention, and abulia or loss of will. The ventromedial region, which is responsible for disrupted social behavior and decision-making deficits, and the anterior cingulate, which results in a loss of will to move or speak despite being intact from a physical capability perspective. And indeed, when the medial prefrontal cortex is damaged, you end up having a condition called akinetic mutism, a state where the patient is awake and aware but exhibits no spontaneous movement or speech. And one of the things that you need to remember is that when this part of your brain is affected, you also have weakness in your legs. You also have urinary incontinence. You lose control over the urine. And this, if you look at the homunculus, the diagram where the brain is represented, the body is represented in the brain, you will understand that those parts of your human body are represented in the medial parts of your brain between the two hemispheres, the medial frontal cortex. And so this is how we need to think about these three areas of the prefrontal cortex. One, the dorsolateral, responsible for executive functions. The second, the orbitofrontal, responsible for social regulation. And the third, the medial prefrontal, responsible for motivation and inhibition. Now, the prefrontal cortex has journeyed from a historical mistake to a modern understanding. And we've stopped seeing it as a silent part of the brain to being one of the highest seats of cognitive function, representing neuroscience's important paradigm shifts. As clinicians, we must remember that the most devastating neurological impairments aren't always the most obvious, and that understanding the nuanced functions of the prefrontal cortex is essential to providing compassionate and effective care to our patients. Now let me move from the prefrontal cortex to your limbic brain and ask you, what constitutes our emotional brain? And here, if you put a finger into your ears on both sides, right in the middle is your emotional brain. The hippocampus functions as a comparator of information and a storehouse of memory. The amygdala is an essential point for cognitive representations and emotional salience. And of course, we have the Papez circuit, which includes the hypothalamus and the basal ganglia. And this entire area is responsible for emotions, human emotions. Now think about this. Your memory store is the hippocampus. Your emotional store is your amygdala. They're both within this circuit, which is your limbic circuit. And this is what you and I share with the humble rat. This is the part of the brain, the oldest part of the brain, that all mammals have. Now, it's our limbic brain which leads to fight, flight, and freeze responses. And if you're looking at the visual guide, you'll see this beautiful cartoon of the eyes looking at a snake, the information being processed through your thalamus and going to your visual cortex. Remember, your eyes are just physical organs. They don't know what you're seeing. It's your brain that knows what you're seeing. So your visual cortex recognizes that it's a snake. And then, of course, that information is transmitted to your amygdala. And there is an outpouring of emotions which then transmits itself through your autonomic nervous system. Hence, your fight, flight, or freeze response. You either stand and fight the snake, try to beat it with the stick that you're carrying, you run away from it, or indeed, if you're terribly anxious, you freeze. Now, this limbic system is a very interesting counterpoint to your prefrontal cortex. And this was what Luria, Alexander Luria, a very famous Russian neuropsychologist of the yesteryears, talked about. He described 3 functional units which form a foundational framework for understanding how the brain organizes complex behavior. The first unit is the unit for regulating tone. The anatomical substrate is the brainstem and the reticular formation. And again, if you're looking at the visual guide, you'll be able to see unit 1 colored in red. Now, this unit maintains appropriate level of consciousness, arousal, and alertness. And without this foundation, no other cognitive function is possible. Damage to this area produces coma, stupor, or fluctuating consciousness, and the patient is simply off. And I'll remind you about what we talked about in terms of akinetic mutism a little while earlier. Unit 2 is the unit that receives, analyzes, and stores information. And this is your posterior cortex, the parietal, temporal, and occipital lobes. Again, in the visual guide, you will see this area colored in red. It processes, analyzes, and stores information from the environment and handles perception and memory formation. Lesions in this area cause agnosias. You have a normal vision, but you're not able to recognize. That's an agnosia, a visual agnosia. It also causes amnesia, memory loss, and perceptual deficits. The patient can't receive or retain information. The third unit is for programming, regulation, and verification of activity. And this is the prefrontal cortex and the frontal lobes. The core function is in planning, executing, and monitoring voluntary activity and regulating behavior based on goals and context. Damage to this area produces executive dysfunction, apathy, and disinhibition. The patient can't plan or regulate his actions effectively. Integration is everything. Complex behavior requires all 3 units to function well. and no unit operates in isolation. Even seemingly simple tasks like making coffee or having a conversation require arousal, Unit 1, perception and memory, Unit 2, and planning and regulation, Unit 3, working in seamless coordination. This framework helps clinicians understand why brain damage rarely produces pure deficits. A stroke affecting Unit 2 might compromise perception, but it also disrupts arousal pathways or planning circuits, the clinical picture becoming far more complex. Luria's genius was recognizing that the brain is organized hierarchically but functions interactively. Modern network neuroscience has validated this insight. Complex cognition emerges from coordinated activity across distributed symptoms. So Luria's particular insight was behavior arises from dynamic interactions and not from isolated regions. The limbic system is responsible for motivation and emotion. The frontal lobes are responsible for planning and control. And the balance between the two is what we see as adaptive behavior. Now imagine that you were a rat and you were listening to this podcast with interest and you smelt something very interesting cooking. You would just leave. You would go in search of what that interesting smell was. As a human, you have the choice. You say, well, I'll go and find out a little later after I finish listening to this podcast, or indeed, let me pause this podcast and then go and check out what's cooking. Now, this ability to plan, organize, manage, modulate, this is the role of your prefrontal cortex. The instinct to go after what's cooking is your limbic lobe functioning well. And therefore, the limbic urge is what provides fuel for action. It drives hunger, fear, desire, emotion. And without it, we would be apathetic and lifeless in our behaviors. The frontal cortex, the prefrontal cortex in particular, provides restraint. It provides the brakes and the steering. It regulates our impulses, enables foresight and social appropriateness. Without frontal control, we will be impulsive and disorganized, exactly like Phineas Gage was, the story that we started with. Indeed, our limbic brain acts together with our neocortex to help us possess our unique sense of self, so unique to being human. Normal behavior needs this dynamic equilibrium, both systems working in harmony. Too much urge will be impulsivity and aggression. Too much restraint will be rigidity and loss of spontaneity. And therefore, the brain is constantly in a tug-of-war between this limbic urge and the frontal restraint. And the result is who you are as a person. Luria's hypothesis on emotional well-being and equilibrium therefore holds true. And when we have a problem, it's either an increased limbic outflow or indeed inefficient frontal control of limbic impulses. As he said, the brain works as a functional system and not as isolated parts. I hope you enjoyed this exposition on the brain's tug-of-war. I hope it helps you understand how your emotions are generated and regulated. If you liked this, please subscribe and share. We are on Spotify, Apple, and YouTube. Thank you for listening.